If you are between the ages of 65 and 70, Niagara Region Public Health wants you to know that you qualify for public funding for both doses of the shingles vaccine. Diane Legros, why should people in that age group take advantage of this?
Well, shingles is an interesting illness because the virus lives in all of us. So everybody is at risk for shingles. And as you get older, that risk increases quite dramatically. 1 in 3 people will suffer from a shingles flare-up at some point in their life. And as you get older, that risk definitely increases.
The way I've always understood shingles, it's sort of a mature version of a virus that we usually come into contact with as a youngster.
That's exactly right, chickenpox.
Chickenpox.
So we all had chickenpox as young people, and then after our rash clears up, that virus just lies dormant in our bodies. And as you get older, sometimes it's just age alone that increases the risk of a flare-up to developing shingles, and sometimes it's an immunocompromising condition, a severe stressful time in your life. So that's why we ask everybody to have a look at your immunization record, talk to your doctor, call public health, because if you're between the ages of 65 and 70, then you qualify for 2 doses of the shingles vaccine for free.
You've also extended it, and this extension neatly is about 3 or 4 years, which sort of coincides with the 3 years of the pandemic.
That's exactly right. So the Ministry of Health has extended eligibility for the publicly funding of the shingles vaccine for anybody born 1949 to 1952. And that's exactly right, because we've had a huge interruption to services because of the COVID pandemic.
Those people were busy getting their COVID shots, and you guys were busy giving the COVID shots. It was very hard to get the shingles shot during that time.
That's exactly right. And that's in addition to everything else. So talk to your doctor about, have you had a tetanus vaccine? Have you had your shingles, your pneumonia vaccine?
Well, this is a good point you bring up, right? Mm-hmm. And you mentioned the yellow sheet or the yellow card. Mm-hmm. And, you know, it would be really worthwhile for anybody to take a look at their yellow card if they can find where they kept it, of course, and just to make sure that they are up to date, because there was that 3-year gap.
That's exactly right. And we have a lot of appointments available at Public Health, almost 6 days a week from now until the end of the summer. So we invite everybody to call us, call your doctor, get in to see a nurse and talk about your vaccines and get protected for everything you're eligible for.
I've had a friend, some work colleagues, my older brother have suffered from shingles. It seems to be very debilitating. Can you describe the pain that people feel?
Absolutely. So the pain associated with shingles, people do describe it as debilitating. Some people talk about it as there's so much pain, it's too painful to even wear a shirt. Just a shirt against the rash is painful enough. Oftentimes too, depending on how old you are and how robust your immune system is at fighting off things, people have shingles experiences around their eyes as well, where it can impact your vision. You can get secondary skin infections. Most of the time, shingles is around one side of the back, one or the other side. And but if it's around your eye, people lose vision. It can be a very debilitating disease. And interestingly enough, the complications that come from shingles can last for a long, long time. So the one thing we were talking about earlier is that it's called post-herpetic neuralgia. And that neuralgia, that pain, that nerve pain, can last up to 5 years after the shingles rash is gone. And that's what we really want to avoid when we're getting vaccination. We know that in adulthood, our immune systems aren't quite what they used to be when we were young. So any vaccination we get, it might not 100% provide you protection.
But it'll help with those complications.
Exactly. So it'll stop you from getting that really severe case, the many complications that are associated with those illnesses. So it's really important to still get vaccinated, knowing that although you may not get 100% protection, you will be protected from those really devastating complications associated with
And
them.
the group of people born between 49 and 52, they've got to do this by December 31st before that expires. How can people book their vaccine?
Please call us. So we have lots of appointments available, like I mentioned earlier. So I think our phone number will probably come up on the screen. And you can call us at the Vaccine Program with Niagara Region Public Health and book into any of our clinics. The shingles vaccine is 2-dose series. So you get your first dose and then book your next one up to 6 months afterwards. And we'd really invite everybody to come and call us, ask your questions. We can help you with booking an appointment. If you want to talk to your doctor as well, most doctors have that vaccine available.
Thanks, Diane, and get those yellow cards out.